a short talk, and then we're going to move into a Q&A. So do put questions or reflections in the chat, or we'll open it out to questions quite shortly.
Fabulous. Thank you very much, Sarah and Anita, for the introduction and for inviting me to come and say a few words as part of the QI week. First thing I should say is a big thank you to you both for hosting this week. It's wonderful to put some effort into actually our own learning and to bringing people together to share that, not just within an organisation, but across organisations now across the country this year, which is super. Really pleased that other organisations have also welcomed the opportunity to join on to this QI week, which has now gone national this week. So big thanks for all the effort that it takes to organise something like this. For those that I haven't met, I'm Amar. I'm a forensic psychiatrist. I work clinically in the east of London. I'm the chief quality officer at a trust where I've led the quality work for about 12 years or so. And now National Clinical Director for Improvement, with the role of trying to help the whole NHS in England adopt improvement in a more systematic and rigorous way. I just wanted to give a few opening thoughts before I give us the chance to get into a bit more of a dialogue. I think it'll be much more interesting for us to be in conversation than for you to hear from me for too long. I do think we're sort of 18 months in now from the launch of NHS Impact, which is an attempt to create a single improvement approach across the NHS. It's not a method, but it is an approach. And it was co-designed with several hundred people. Many of you may have been part of that effort to really understand what it takes to adopt and embed continuous improvement in an organisation. So the framework itself describes 5 fairly common sense things, I think, that organisations need to really grapple with and think about if they're going to adopt and embed improvement into the way in which an organisation lives and breathes and works. 18 months into that, and obviously this is not the first attempt in England to adopt improvement at scale. There have been previous frameworks over the years as well, all of which have probably taken us some distance towards our ultimate goal. But I do think at the moment there is a much greater sense of energy and appetite for improvement than I've certainly seen in the last 15 or so years that I've been dabbling in this field. And I think we have a real opportunity ahead of us to do what we can and use the national impetus that this framework and approach brings to really equip organizations and systems to see the benefit, the true benefit that thinking in this way and working in this way can bring. And in doing that, I think there are 3 big things that we need to consider as people who are committed to improvement and have been learning about and applying improvement in whatever part of the country you're from. The first of those is to really focus in on and learn about what it takes to co-produce improvement. I think this is an area that is still, there's still a lot of variation across the country, and we know that improvement that is really properly co-produced, where people with lived experience are part of the improvement effort from the very beginning through to the very end. We know that that way of doing improvement leads to a much greater likelihood of success in the improvement effort. But not just that, we are much more likely to get better ideas, a better understanding of the system, and actually the people involved can gain a whole set of skills and confidence from being part of improvement work that can then help them in their own recovery and perhaps lead them back into employment if that's a goal of theirs. So I think there's a whole set of benefits that come from really applying co-production to the way we do improvement. And I think that's an area that this country has some superb examples of. Projects, programs, organizations that truly focused in on how to do this well and have experimented and are still learning their way through it, but are probably doing it the best that I've seen around the world. And I think there's a big opportunity, but also a big challenge for us across England to truly focus in on this aspect of how we do improvement. Because if we get this bit right, I think it will make a massive difference in strengthening the way we do improvement and also extending what we know in this field globally. The second big opportunity for us, I think, is to help people realize that this word improvement, that is now, used very liberally and is a very easy word to sort of bring into our natural language, actually has a really crisp definition when we are applying it to work and problem solving. So we have a responsibility, I think, to be guardians and shepherds of how we approach this work of improvement, and to do it in a rigorous, best practice, systematic way that's guided by evidence base. Because again, when I look across the country, there's quite a lot of variation in what people even describe as improvement work. And if we're serious about this, we need to be really clear what the standard is for what we call improvement, and be really clear about what the best practice tells us about how to do improvement, and do it as closely as we can to that, and with the goal of delivering results for the people we're here to support. And that's what rigor and systematic approach of improvement should help us get better at, producing results at a quicker pace. The third thing that I thought I would just open up by giving some reflections on is the opportunity around really considering what it takes to do this at scale. It's all very well applying improvement to a project or in a part of an organization, or in a single service. But actually, if we really want to adopt and embed improvement across a country as complex and vast as England, we have to learn what it takes to do this at scale. And there comes a whole series of considerations for us. Like, what is the infrastructure we need to be enabling hundreds of teams, sometimes teams made up of people from different organizations, to be learning and applying improvement to problem solving on a daily basis? What kind of skills do we need as improvers if we're really going to be adopting this approach to problem solving for our biggest challenges in our organization or in our system? Again, improvement is often delivered through a series of projects at a microsystem level, and that there's nothing wrong with that. In fact, teams should be able to use improvement to work through their problems. But actually, we also need to be able to help our organizations and our systems tackle their biggest challenges with the use of an improvement method. And to be able to do that, we as improvers need to learn how to design large-scale programs that are going to deliver results, and be able to help build belief in our organizations and systems that this approach is a more rigorous way than other approaches to what people might be leaning on to if they want to deliver results in a fairly quick timescale. So I think there's a question for us about what is that infrastructure and how do we build it? What are the kinds of skills we need as improvers to not just coach a single team, but to now be able to design and run large-scale improvement programs at scale, and how to take ideas that have worked in one setting and scale them up. These are complex pieces. These are complex aspects of improvement. And I think the number of people who really have experience of that kind of work in this country is pretty small. And I think, again, there's an opportunity for us to really learn what it takes to do that kind of work, and to extend our technical skill set and be able to lean into that space in our organizations and systems. So I think, Sarah, probably three initial reflections from me that are really big opportunities for us in the field of improvement in the next year or two. One is, like, how do we focus in on the gap there exists between how we do improvement now and what really good co-produced improvement looks like? Because there are some fantastic examples to learn from in this country, and yet the variation is significant. And we need to all be thinking, how do we know what good co-production of improvement looks like? How would we measure it? How would we give assurance that we are co-producing improvement as often as we can across all areas of our work? The second is, what does really good practice in this field look like, and how do we apply that rigor to all the work we do? so that when we talk about improvement, we are all recognizing really rigorous application of method in it that is delivering results. And the third is, how do we do this work at scale? What does it take, both in terms of infrastructure and skills, and how do we equip ourselves for that ambition? Because if we're truly going to adopt improvement across the country and see it as our vehicle for delivering results, we're going to need to be really adept at scaling, and building and designing and running large scale improvement programs. And that is a skill set that I think is relatively thin across this country. So we're going to need to build that over time in the next year. But I guess that perhaps for us to work our way through those three really big opportunities, the power of networks like this and opportunities to come together and learn are absolutely critical. So, I think all of us need to find ways for us to keep learning. It's really easy in the world of improvement to just be 100% focused on the work ahead of us because there's so much of it to do. If you read Darzy's review that came out yesterday, you'll have a sense of the scale of the challenge that we face across all aspects of the NHS. And so we're not short of work to do in the world of improvement. But we still have to find time for ourselves, make sure we are learning, make sure we are connecting with peers, learning from each other, challenging each other, making sure we are really raising our game and building our practice as improvement professionals. And so sessions like this, communities like this, networks like this are absolutely critical. Sarah, I wonder whether you had any thoughts about some of my initial remarks, or you want to put some questions to me, and then we'll invite the group to come in too.
So they resonate quite deeply. The different definitions of improvement and what we mean by it. It's become.
I get on until tomorrow. Okay.
Possibly possibly a bit of a buzzword that people throw around because it sounds like the sort of thing you're supposed to say, and isn't always. It
will throw them all if I go back.
And then the other thing is the learning how to do this at scale. So I think there's more and more capability and capacity to do the smaller scale projects, but how we bring people together to work at scale is and to achieve sort of large scale change is actually really, really difficult. But we'll get there. I think there's good focus and there's good skills and there's brilliant engagement. So learning from each other and having good examples is really helpful. So we'll open it out to questions. I've got some here that have come in through different routes as well. So I guess it's a really sort of hard question, but something playing on my mind at the moment is there's related to Darcy yesterday, the report and the scale of the change, but also the very difficult circumstances pretty much everybody finds themselves in financially and otherwise, and in some cases with kind of turnaround teams or whatever coming in, and how we work alongside those teams or influence them so that they would use a kind of improvement principle as opposed to a naughty step principle, arguably, about how we turn them around. So I guess the question is how do you think you're doing within NHS England to start to build? When you started, you talked about building the culture of improvement and capacity and capability and principles there. How's it going?
Thanks, Sarah. Yeah, so I mean, the commitment to adopt improvement across the NHS in England extends to integrated care systems, to regional teams in NHS England, and to national teams too. Obviously, each of those levels of the healthcare system have slightly different roles, and they get further away from the point of care where value is created. But there's a real desire to adopt improvement into the way NHS England works as well. And a few of us have been helping the most senior leadership in NHS England think about what is going to be the right choice of method NHS England to adopt, and then following that decision, how are we going to skill people up in NHS England to learn that method and apply it to their work. It's going to take time. This is not a simple thing to do in an organisation that is quite dispersed and with a range of different functions. But I think NHS England has started this journey and is keen to learn as it goes. It will take quite a bit of time for that to translate into different relationships and sufficient capability to be able to actually support improvement work. But we need to work in parallel. We need to work at different levels of the system at the same time. There's some really great examples of integrated care systems across England that have been grappling with the question of what is their role in supporting system-wide improvement. The work that can only happen across organisational boundaries, where we need multiple partners to think about how to solve a complex problem. And there's some great examples. Just this thinking about Bedfordshire, Luton and Milton Keynes is one example of that in my own local patch, where they've really been looking to build capacity and capability for improvement and now deploying it to priorities across the system in a really intentional way. And then there's other great examples like that, like at Surrey Heartlands or in Kent and Medway. So there's some great examples of this happening outside of trusts now, and that is an opportunity. It's a challenge to think about in the structure that we have, and I can't see us moving to another restructure of the NHS. I think Darcy was very clear that that's neither necessary or desirable. There might be some clarifying roles at different levels of the structure in the NHS, but I think this structure that we have now is the structure we're going to see for a while now. The question is, what is the role of each level of the system in supporting improvement? And obviously, it gets a little bit harder to see that the further away you get from the point of care as to what exactly is your role. But that's the sort of thing we're helping systems and then regions think about what is their role. As an example, next week we will be taking a very different approach to winter. The usual approach, the NHS England approach to winter, would have been to send everybody a letter outlining what it wants every system to do and focus on. That hasn't happened this year. And then there would have been a whole series of sort of performance management of particular metrics over winter. And then, that's often in the past led to, slightly uncomfortable conversations with the CEOs of trusts where they have ambulances queuing up outside or where something's not going so well. This year, there's an attempt to do something different, and every region will be hosting and facilitating learning and improvement networks that bring people together at clinical level and operational level, informed by a theory of change that's been co-designed nationally and some data over time, which is all standardized, and an attempt to apply improvement to our biggest operational challenge right now, which is how do we manage the demand over what is traditionally a very difficult time over the winter months. So I think there's some steps in the right direction, Sarah, but there's a lot more to do. And I think all of us have a role to play in that, to really, really demonstrate the value of taking this way of working. The money challenge is not going to be far from anyone's minds at the moment. I'm not sure I'm a fan of the word turnaround because, if you think about turning something around, you want to. What we're saying is we want to head back in the direction we were in before. I'm not sure the direction we were in before is the right direction. What we really are thinking about is what we should be thinking about is how do we apply improvement approaches to help us build a more sustainable health system, thinking about quality and cost together rather than separately, and looking at waste and thinking about redesign approaches and making sure all of our improvement efforts have a real eye on what's the potential cost avoidance or cost reduction or productivity improvement or efficiency improvement. What are those that are likely to result from a piece of work I'm doing, even if the focus is on falls or UTIs or pressure ulcers? There will always be some impact on productivity, efficiency, cost avoidance or cost removal, and are we really clear about that, and can we measure it to demonstrate the impact? Then we can start to show that improvement is not just about quality. Because if improvement stays in the world of quality, it will never become the single way for us to solve the challenges in healthcare. It has to go beyond
that. So there's a question in the chat about, please could you expand on the theory of change that you referred to? These are all easy questions so far, right? Sorry.
Claire, hi Claire. So I don't know whether you've come across the term theory of change before, but it's a way to bring together our current understanding of how to solve a problem. And there are different ways to do that through different methods. But, the first three areas that we're applying improvement to at national scale are the topics of the urgent and emergency care pathway, outpatients, and theatres. And for those three areas, we have brought together what we currently know has been shown to work, either from the evidence base or from people's own improvement work, testing and learning about what might work in a given setting. And we brought that together into a theory of change. So that's described as a driver diagram and a whole set of resources to show if you wanted to try this idea, where could you go and learn from, what resources are available to you to try that idea. So, as people start to form into these networks, these learning and improvement networks in each region or system, they will have this theory that brings together what we know about what's been shown to work in different parts of the country. And some of those ideas you may have used and tried already, but there might be something new in there. You think, oh, that'd be quite interesting to test. So the idea is to offer it as a theory, and for each system to then think what in there might be valuable for us to test locally. They should be published on Monday. So we should be able to get access to them from Monday onwards.
Great. I'm just going to throw in one of the questions that came into us when we asked on social media. So who has most inspired you in your career, and how have you navigated conflicting priorities to always maintain the focus and investment in improvement?
Oh, it's very difficult to pin down one person who's most inspired me. I think if I think about what really has helped me reflect on my own practice, it's been when I've been in listening and learning mode, and you have to make a conscious effort to be in that mode, particularly when you're in an executive role and you're in a decision-making capacity. But when I have either gone and observed, and I do a lot of that in my daily week, just going to teams and seeing and hearing about the work they're doing, particularly hearing from patients and service users who have been involved in improvement work about the difference it's made for them and for the team to have them involved. I think that's very powerful. It's made a real big difference in helping people here in my organisation in East London understand quite the power that this had. I don't think we realised that when we began this improvement journey 10 years ago. We sort of knew it was the right thing to do, but not until we really heard these stories and saw the impact for our own eyes did we really see the potential that this might bring to what we were all collectively trying to do. The other bit of inspiration has always come from going and seeing other places, and it's something that I still try to make time for in what is an increasingly busy job, is to go and see and learn from other places. In fact, yesterday I was in Scotland as an example, and continuing to learn from their work. And I think that's important, because you can only really truly reflect on your own progress by sort of seeing different perspectives, and going and seeing another system and hearing from people who are doing similar work in a different place, with a different context, different population, helps you think about your challenges in a different way. And I brought a number of different ideas back from different parts of the world to our own work. So I guess it's probably not a perfect answer to that question, but I've learned a lot from sort of making sure that I'm observing and listening much more in my daily week, in my working week, and actually taking conscious time out from where I'm working to go and see other places. I think it's difficult to do that, but whenever I do, I always really value it.
It was an excellent answer, not far from perfect at all. There's another question around opportunity to do shared learning with the private sector as well as the health and care sector, which was done traditionally, and what your thoughts are on that in terms of driving efficiency.
Well, so efficiency is one aim of improvement. It's not the only aim, but I mean the underlying theory there about learning from other industries is absolutely valid. I mean, healthcare did not invent improvement. Right? It came from other industries who are obviously going to be further along in their thinking and work than us. In fact, it's a real sadness to me that the Gen Q program doesn't exist anymore. The Health Foundation used to run the Gen Q program.
Totally
One of the
agree.
real benefits of that used to be structured visits to other industries to learn about their approaches to continuous improvement. Without that sort of structured program in place, I do think we have to make extra effort to sort of go and make those connections. And actually, many of us might have connections that we haven't previously tapped into that might offer us routes into this. A friend of mine works in Scotland, and her brother works in a whiskey factory. And actually, as we got talking about this, that factory has approaches to quality control, quality improvement that are light years ahead of healthcare. And visiting it, learning about it was totally serendipitous. But it didn't take much to organise because her brother worked there. So I think all of us might have connections to learn about this in other fields. They may not use the same language as us. They might call it something different, but every other sector, including the voluntary and charitable sector, will have approaches to improve and deliver better outcomes for its end users. And I think it's definitely worth finding opportunities to do that.
Do you have insight in shifting organisations from being led by traditional project management approaches to more improvement methodology? Well, we know that you do. So any top tips?
Yeah, I mean, obviously I've, over the last 10 years, I've worked with lots of different parts of the country, different organisations, different parts of the world, helping, from single teams to organisations and systems to whole countries think about how to adopt improvement. And there is a transition in that. It's not that suddenly one day you go from one approach to then flipping to another approach. There's always going to be that messy bit in the middle where you start learning about improvement, you build belief that it might offer a better route, might then be able to solve some of your bigger challenges. You then try doing it at a bigger scale, and eventually it becomes your vehicle for all types of problem solving. But it's not that you will never you can't use other skill sets. I'm not sure you can do a piece of improvement work without some project management, right? I struggle to see how you could apply the discipline of quality improvement without some of the skills from project management being absolutely at the heart of it, with clarity around roles, project structure, really effective meetings, actions that are followed through. All those things are critical to improvement. If you think about digital and the world of digital, sometimes they use different words in digital, like agile and transformation, but ultimately some of the practices are probably going to be really important to the way in which we improve in the future. And it's hard to see that improvement isn't going to be influenced by a whole set of concepts and ideas related to changing from analog to digital ways of working, often using generative AI, thinking about automation as a change concept. Those things are going to just become increasingly prominent in the work that we do to improve systems. So I think we need to figure out how we bring these different fields and skill sets together into a single way of improving. Even looking at the research field, that most organizations have people highly skilled in research methods. And again, it's such a shame, isn't it, for that to feel like it sits outside of improvement? Why would you not harness that in order to enrich your improvement efforts? Really thinking about how to use evidence the evidence-based and literature searching to create a stronger theory of change at the beginning, how to move beyond just, single PDSA tests one after another, which is just one way to do quality improvement. There are more sophisticated and complex approaches to quality improvement that get you closer towards, quasi-experimental study designs where researchers have a lot of experience and could help us learn faster and with greater sense of belief about which ideas led to improvement. So there's opportunity for us to bring people together with complementary skills and align them all around purpose. And that's what really good improvement systems do.
So there's some great networking and sharing of resources in the chat as well, which is brilliant, as well as the questions. There's a question here about permission to fail. So I remember you used to do, I think a few years back, you might still do it, your newsletters, and one of them, or regularly you would put out projects that didn't work and why, which really struck me early on, and I thought that was great. And there's a question from Julia Robson about permission to fail as an important aspect of QI culture. What is your advice to embed this in system work?
Hi, Julia. I think it probably starts with leaders recognizing, that if we're going to truly solve some of these complex challenges, we're going to have to try things that haven't been done before, and that there's an inherent risk that they won't work. I think quality improvement done really well can help us manage that risk by testing and learning rapidly. So if we can find a way for our most senior leaders to actively sponsor improvement efforts, to give people permission to try things, I think leaders are suddenly get very energized when they are involved in an improvement effort, and then they hear the volume of ideas, the diversity of ideas that can come just by inviting. I think they immediately see that not all of them are going to work. But I think they genuinely, most leaders will genuinely be interested in people trying things if they're doing it in a structured, methodical way that's aimed at learning. And I think our leaders need to give people permission. I think only our leaders can give people that permission and know that that they have people's back, and be vocal about saying that if it's okay if it doesn't work. We need to try new things to achieve better levels of results. And I think we then need to find ways to safely share that, these were the things we tried, they didn't quite work, but here's what we learned and here's what we did next. Then there's many ways to convince our leaders of this way of running organizations. I'm not suggesting this place has it cracked, but every one of our executives has read Amy Edmondson's book, The Fearless Organization. And I think there's tons to learn from Amy's work, and she now has great podcast and a new book out as well. But what we're really talking about here is creating that sense of psychological safety at scale. Now, every team has a different climate, and the climate is hugely influenced by the leader or the manager of the team. So we really need to work with those tiers of people who have great sway on climate across organizations to think, how do we create a climate where people feel safe to speak up when things work and when they don't work, and also just come up with ideas that they think might help, and then have the permission and the process to allow them to try it in a safe way. That's the goal. And I think really it's the job of management leadership to create that sort of safety for innovation. But we can help with that, because if people truly adopt improvement in a structured way, it manages the risk. So we're not saying something, is going to have disastrous consequences. I mean, we need to understand that risk and then mitigate it through the really good use of PDSA cycles, and do those in a robust way. And again, evidence shows us that we don't do that very well. So I think there's a question mark for us as improvers. If you look at how PDSA has been used around the world for the last 10 years, actually most of them are not proper PDSAs. So we have a role to play in this, about helping teams learn how to manage the risk of something not working through structured experimentation. And we should help people learn and apply that.
There's So Lou Waters, would you like to come up with your comment? Because I think you're probably expressing something that many people in the room will also be feeling. Kind of.
I think hi Amar. I think mine was around that feeling that, maybe you're the odd one out, that you're not going to get to where you want to go. And I think, we all look to Elft and we see this amazing journey and we recognize it's taken 10 years. And I think sometimes that, it can feel like, well, what if we're the exception? What if we don't get where we want to go? And what if our organization gets stuck and we sort of reach a level that we can't get past? Is it a case of just keeping blind faith? And I sort of wanted to put that out there because I think, I definitely sometimes think, what if we don't get where we need to be? And I can't be the only one in the room, I would expect, that sometimes has that worry. Is there any examples of places that you've seen get stuck, and do you know what that was about, or do you think it is just keeping the faith and continually building over time and sort of chipping away at it?
Hey Lou, great question. Keep in mind that and you only see one perspective of an organization from the outside. The inside is never the same as what you see from the outside. So what might appear to be a shiny example very rarely is a shiny example, and most people will admit that openly, that things aren't perfect anywhere. Everywhere has bright spots and dark spots, variation that they're paying very close attention to. I think the other thing to just keep in mind is that there is no possible way on earth that every organization is going to have all the constituent parts to be able to do this kind of work all at the same time. Never going to be realistic. And sometimes organizations are just not ready, despite all of the best efforts that we can make. And we have to acknowledge that. It takes a lot of different ingredients to be able to undertake this kind of shift in ways of thinking and leading and working. And it's not a race. There's no prize for getting there first. In fact, there is no end to this anyway. So you'd never get to the end. But there's definitely no qualms in acknowledging that actually, what we've probably learned is we're not quite ready for it. We need to do some foundational work, or these things are not in place and it might take a couple of years to get there. People now talk about East London Foundation Trust as if it's a poster child, but it's certainly not. And most people don't know the 2 or 3 years of very difficult preparatory work that needed to happen. I was there for about 2 of those 3 years, and it was not easy. There were some very difficult conversations. There were some trying times. There were lots of points at which it felt it was not going to happen. And it took 3 years to even start. People don't remember that bit. I remember it because I'm one of the few that's left here from that period, but they were not easy times. And many organizations don't make it to the starting point, and they're not ready, and they have to come back in a few years when they are ready, because you need a lot of things to be in place, I think, to do this work. And there's no expectation that everyone will get there. And I know industry in the world has been able to show that every provider is able to adopt this way of thinking and working at the same time. It's not possible. But we should do what we can to enable it. And that is going to need multiple interventions from different parts of the system. So we can do what we can from inside, but there have to be enablers from outside. And there has to be people thinking about, talent management and senior leadership recruitment. And, people have to have sufficient staffing, sufficient clinical leadership at different levels of the organization. There's a whole range of factors that are absolutely critical to being able to do continuous improvement work.
Lou, did you want to come back in?
I did. I want to say thank you, because I think sometimes it's very easy to see that poster child, and to see what looks shiny, and sort of that's our goal. And I think sometimes it is really important to bring us back and remind us, that what looks from the outside isn't always the same from the inside. I think that's a really good takeaway point. I wonder, I'm just wondering if there's an opportunity here, because we tend to be really good at sharing what works. And we publish articles on what works, and we publish, we do webinars on what works. And I'm just wondering if there's an opportunity here, maybe through the Improvement Learners Network, to do a bit more sharing of when things are really hard and how we've overcome those in different organisations. And actually, we're really stuck with this. How did you get over that hurdle? And I'm just wondering if that's an opportunity that maybe the Improvement Learners Network could pick up after this.
Yeah, great suggestion. Absolutely. And that's the sort of place we want to take those networks to. We have 2 national networks now, and I think they're both heading in the direction of starting to get to that level of collaboration around real challenges and real opportunities that we see together and working together. And I think the Improvement Learners Network, because it's a bit more open and it meets every 2 months, it's sort of heading in that place. The sort of directors level, the executive level network is already in that place, and I was with them this morning, and they've very much moved already from just forming and building relationships to now actually grappling with real things and sort of helping each other with common challenges. And that's great, to have got to that point in 6 months with that network.
Okay, and probably just we're getting close to the end now. So Louis, did you want to come? It's Louis Faber still there? There was a question about data, and I think improvement maturity going alongside sort of data maturity. One of the things that came out of the Health Foundation's factors critical to learning systems, and I think was probably in the Darcy report alongside the digital, and how do we help people move from performance focused data to process and improvement data.
Yeah, I think it's a great observation, Louis. I would say our Darcy's remit was not to really think about how to solve the problem, but more to diagnose. And it'll be interesting as we work on the 10-year plan to think to see what is the stated role of improvement in tackling some of these areas, because that was not really mentioned too much in Darcy's review yesterday. Data is obviously one aspect of this. I think sometimes people overstate the importance of data. It is important, and certainly in helping make better decisions, it's really useful to understand variation. And to be able to make decisions based on a good understanding of variation. But I honestly think there's probably an even more important aspect. I think that's holding back quality improvement maturity, and that is mindset. I think the mindset of how we solve problems in the NHS is the biggest thing we have to shift. Ultimately, people will rise up through the ranks because they're extraordinarily good problem solvers, and they are very used to sort of seeing a problem, finding a solution, and implementing it. And actually, that is completely the wrong mindset for leading a continuous improvement organization. You then need to see your role as problem framing and creating the environment for others to solve problems. That's the shift. Unlearning that you are the source of the solution, and learning that you are the ultimate architect of the environment in which others can solve problems. For me, that is the biggest shift we need to see.
So as a last question.
Sorry, I stepped away from the computer as soon as you started asking the question. So just wanted to thank Dr. Shah for answering the question. Thank you.
Thank you. So Amar, you have a number of busy jobs, not only just one. So what is it that you do to step away and look after yourself and keep smiling?
Yeah, well, my free time is largely occupied by my teenage girls and their various pursuits. So I'll be spending most of this weekend on the netball pitches in the freezing cold and perhaps in the rainy weather. So that they keep me grounded, and we enjoy a lot of sport and music together. But I think for me in my working life, it's really important for me to to plan things where I go and learn from others, and to sort of fill my cup up to make sure that I have enough to give to others. and can maintain hope and optimism, because that is such a key requirement if you're leading in these times. So, I mean, that's why I was in Scotland yesterday with others who I, learn a lot from, being able to see work and hear about it. And that sort of thing fills my cup for the next few weeks.
And just finally, do you have any questions or asks for us, or final reflections?
Oh, I mean, thank you for making the time. You've all done exactly the same, which is to set aside the demands of the day job and take a bit of time out for yourselves to think and learn and connect. And I think that's brilliant. Keep doing that. That's the only way we're going to develop our own practice and make a real difference for the people we're here to serve. So thank you, everybody.
What a fantastic way to end our second QI week. And there's lots of connections being made in the chat. There's lots of sharing. So it's been a win-win, I think. So have a lovely weekend, everybody. And thanks very much for joining. And do keep in contact as we go forward. Not wait until the next QI week, but keeping those connections live. Thank you very much.
Thank you.
Thank you.
Thanks, Amar.
Fantastic. Thank you.
Thank you.